I have 3 inhalers. They are rescue inhalers, including this one for right now. This is Air Supra, this is albuterol sulfate, and this is Pro Air Respiclick. Now, when I say maybe this patient is having technical difficulties with the timing of this particular inhaler, which is a meter dose inhaler, I may suggest to that patient that I want you to take this because this one is easy. It's ready to go. You exhale, take a deep breath and count to 10, and that's it. So for the elderly, the people who are limited on the technique and they don't want to have a spacer attached to their devices, or it's too much, you're thinking compliance may be an issue, I sometimes prefer to use this. Ideally, for the very elderly, I like to use this because teaching sometimes is limited. Or people who have dementia. I have a personal experience with that one, and that's difficult. People are going to be forgetting, and loved ones still want to take care of them and give them the easiest inhaler. So it is ideally, and I wish insurance was watching some of my videos to understand the pain we go through, because we are now saying, well, we can't have this denied. They need to use this. So people just prescribe this, but majority of the patients come back or see me on a consultation, I have no idea how to use this. I wish I would just cover this, but I guess money, maybe contractual limitations. It's not formulary for many, and it gets denied and it piles into my paperwork. So I comply. I order this and I add a spacer. Or if they're very elderly sometimes or limited, I ordered a nebulizer, which is a lot to do to set up their nebulizer. Now, this is the new kid on the block. It's got a little inhaled steroid inside, so it's a inhaler rescue rapid plus. So it's an advanced inhaler rescue medication, and I like it. But if it's not covered, technically it's the same limitations as the albuterol sulfate. I would want them to be on this if they cannot use this, or I could have them use this. I have to fight with insurance still because it's pretty new, and then I need to add a spacer. Or I just say, hey, I give up. I don't want to do the paperwork. To be honest with you, I really don't want to do the paperwork because it's a lot, and short staff, everything else that you can think of. It is very difficult to trace down the paperwork and make sure everything is done. So my dear, I am going through all these. I have a little video that I did for you guys showing how to use all these so you can see them. Just remember, you can add a spacer for these two. The albuterol, Air Supra, and this one doesn't need a spacer because you just open and instruct somebody to exhale, of course, with all of them, and then take a deep breath and hold for 5 to 10 seconds if you're able. Excuse me, I have a little bit of too much going on in my house right now, but I hope you guys are learning. Today I will be doing, I hope, a live for a short period of time this evening. So I hope you guys will be able to join me if you have questions. I know most of you are shy, but I'm shy too, and I'm practicing. Take care. It's Dr. Mukono.